Now.
Yes, we can.
Lovely. So I'm just going to start now. Thank you so much again. If you could not hear me in the beginning, uh, just to give you, I'm going to turn my camera off just so that the internet doesn't slow down again. Yeah. So I'm Dr. Shitij, and I would like to start by thanking Mr. Ashish for involving me in this session. I really appreciate it, and I'm very happy to be here, trying to help out fellow IMGs, having come through the same journey like Dr. Abhishek. And I took the Plab pathway to get GMC registered, and I'm now currently working as a trust grade doctor in renal medicine. And just like Mr. Ashish just said, that it is a struggle. It's not easy. And also to point out what one of my colleagues said, that you have to see this as a marathon and not a sprint. It is a difficult journey, but I can tell you from my own experience, it's been worth it in the end. So, and we hope that we can help you with our insights and our experience of going through the journey. Uh, so, what I and along with Dr. Abhishek are going to talk about is how to get to the point where you're GMC registered and can now finally realize your dream of working as a doctor in the UK. Um, my friends have already talked about clinical attachment, various IMT pathways and examinations. But to even reach there, you have to first get through this journey known as Plab. And I'll be happy to share my experience and also share some of the advice and tips that could be of helpful to you all. Okay. Uh, so to start with, I would like to briefly talk about what are the ways that you could get to the point of getting GMC registered. For an IMG to work in the UK, you have to have a GMC registration. There's different forms of GMC registrations that you could try to get. Basically, I would divide them into three types of registration: a provisional GMC registration, a full GMC registration, and a specialist GMC registration. By provisional, what do you understand by that is it's for someone who has completed PLAB but has not completed internship after getting your primary medical education back home or overseas. So if you've completed PLAB, you've not done an internship, you would be eligible to get provisionally registered with the GMC. What does that give you an opportunity to join is you can now join a UK Foundation program training, which is similar to the internship that we do back home, but you will not be eligible to apply for any non-training jobs like the trust grade jobs. Whereas the full GMC registration is something that you are eligible if you have completed PLAB and you've also done your internship back home, which basically tells that you have worked for a year at least as a junior doctor. Then you will be eligible to get a full GMC registration, and then you can apply for all non-training jobs as well as directly to specialist training jobs, but it would exclude you from the UK Foundation program. Yeah. The third pathway is a specialist pathway. This is for many. I could already see many messages in our chat group of people asking, "What do I do after I've done an orthopedic training or a surgical training?" So this is the pathway. We also call it a Caesar pathway. Someone who's completed the MBBS has worked a few years as a junior doctor and then completed their higher specialty training as well. So if it is accepted by GMC, this is the pathway for you. My focus today would be for the provisional and full GMC registration because that's the pathway that I took as well. Now, this is the topic that I'll be mainly talking about. What is PLAB exam? Uh, Most of you present in this session today must have gone through this exam. Some of you might be just starting your journey of PLAB. I like to call PLAB a journey because it is a long journey and it is a bit of a struggle as well. But like I said earlier, I think it is worth it to go through this journey and realize your dream of working in the UK. Yeah. I myself have gone through this pathway. Like I said earlier, I am an international medical graduate from Nepal. I did my MBBS from BBK. Then I decided to get my IELTS exam, registered for PLAB, gone through the PLAB exam, and now I've landed a job in the NHS as well. So I will take you through this journey and also hopefully will be able to help you with the insights I gained while I was on this journey. So PLAB exam, it's a licensing exam. for GMC registration that would basically make you eligible to work as a doctor in the UK. It stands for Professional and Linguistic Assessments Board Examination. And like I already told you, you need GMC registration to work as a doctor in the NHS. What does it consist of? It consists of two exams. Plab 1 is the first one, and Plab 2 being the second. The first part is basically a theory exam. It's an MCQ based exam, 180 questions in 180 minutes. It's a very time sensitive exam, which will basically test your clinical knowledge. Plab 2, on the other hand, I feel is a very special exam. It's a one of a kind exam, I feel. I've never given or came across an exam like this. It does not just test your knowledge and clinical skills, but also test you as a human being. And I think that is very important for a doctor to have that aspect tested as well. So we're going to try to dive deep into these two examinations. Now, this UKMLA, this is a new term, and many people get confused regarding this. Is Plab still the thing, or the UKMLA has completely replaced it? So I'm going to try to give you a little bit of insight into what UKMLA is. It's and still UKMLA. It stands for United Kingdom Medical Licensing Assessment. This has basically replaced the Plab exam in ways, but still very similar to what Plab is actually. It still has two parts. The equivalent to Plab 1, now it's called Applied Knowledge Test and AKT. And equivalent to Plab 2 is a CPSA, a Clinical and Professional Skills Assessment examination. The main point that I would want all the IMGs who have booked their Plab 2 and are about to appear in this is to go through a UKMLA content map. You can Google it and you'll find a PDF. I think this is the only difference I found in Plab and UKMLA. There's no need to confuse yourself. It's basically the same thing. The content, the things you study, the stations, everything is the same. It's just that now the UKMLA content map has replaced the Plab blueprint, which used to be the gold standard for IMGs to go through. Okay, these are the topics I need to cover to successfully pass this exam. The UKMLA has now, it has a stronger emphasis on the UK clinical standards, the ethics that comes with practicing medicine in the UK, which is very different from what we do back home, the professionalism required, and the communication skills. Is Plab no more? No, the Plab is still there. When you book your examinations, you still book it as Plab 1 and Plab 2. But now the criteria that they judge you on has it slightly differs from what it used to be. So the UK MLA, it really focuses on the way you practice medicine in the UK now and what they are expecting from you. So I think it would be very helpful if you could go through the UK MLA content map to give you a brief idea, the new things that they have added on the assessment and which basically affects the outcome of the examinations now is, are you ready to practice safely in UK? What is your focus when you are taking a history or an examination? Are you focused on the patient or not? Do you really, can you put the patient as priority when you do the assessment? And how do you deal with uncertainty? Just something that you come across daily in your medical practice. Actually, you can't. I wouldn't say easy, but I think it's helpful when you have a diagnosis in hand, when you know what you're doing. But what do you do when you don't know the diagnosis? Let's say a patient came with complaining of tiredness. You did some investigation, it came out as anemia. You know what to do then. But what do you do when you don't know what's the diagnosis and what's happening? How do you deal with uncertainty? So I think these are the points that you have to make yourself familiar with before appearing in Plab 1 and Plab 2 now. But are they different things? No. So do not confuse yourself. The UKMLA has been in action since November 2024, if I'm correct. And it's only basically the assessment criteria has changed a bit, but the exam is exactly the same. So you don't need to worry about your preparation. Now, what are the prerequisites for you to appear in Plab examinations? You have to be qualified. You have to get your primary medical qualification completed from back home or overseas. Make sure that your university or medical college is listed on the World Directory of Medical Studies, medical schools, sorry. Then the next step after you graduated from medicine differs in different countries. Some countries it's 4.5 years, some countries 5 years. Once you've got your degree, you need to now prove your English language proficiency. basically via two examinations. You can choose either one of them. IELTS is the one, the classic one, and OET is something that's been in action since a few years now. I, in my time, gave IELTS, which was this used to be one of the golden gates, I used to call them. Most of my friends could not get through this. This used to be the toughest exam during my time because you need to get a very high score for you to be qualified and be able to book Plab 1. You have to get a minimum of 7 in each module, which is speaking, listening, writing, and reading, and an overall band score of 7.5, which I can tell you from my own experience is not easy by any means. The OET, on the other hand, you need to gain grade B in each module. Why I consider OET slightly easier than IELTS is because this OET is um, the, the assessment of your language is basically on a medical scenario. So that makes things a little bit easier for a medical professional who's gone through their primary medical qualification. Whereas IELTS, on the other hand, is completely language. It's English, basically. You're not being tested for anything medical. Your English needs to be on point. So that's why it can get difficult for someone who does not practice in a English speaking country. What happens after you get through your language proficiency assessment is then you'll be eligible to create a GMC account and book and sit for Plab 1, basically. Without providing your passing certificate for IELTS and OET, you're not allowed to book Plab 1. After passing Plab 1, you're eligible to now book and sit for Plab 2. Plab 2 is something that you have to come to the UK and appear, so that's a whole exciting journey in itself. And after you pass your Plab 2 and you get your scores back, then you're finally eligible to apply for GMC registration. Now, the first step I would want to talk about is how do you plan for this exam? You need to first familiarize yourself with what Plab 1 is. Like I said already, it's a written examination, an MCQ based assessment. You have to pass your final year medical examinations first. So you can start preparing early, but I will always suggest first finish your final year medical examinations. Then, during your internship, it would be really wise to start preparing for IELTS and OET, book it beforehand, join courses, and give mock examinations and stuff like that. You to clear this step as well. When you book Plab, so basically your IELTS and OET needs to be valid at two stages. The first one is when you book your Plab 1, and the next one is when you apply for GMC registration. So I would suggest you to plan your journey in a way that once you book and give your IELTS exam, you should be planning in a way that you reach the GMC registration point within 2 years, which can be difficult considering how difficult it is to get the dates for the exams nowadays, especially for Plab 1. I hear it's getting very competitive, and if you unfortunately, if somebody fails and they need to book again, I've seen many candidates having to wait for even a year to book the next exam. So I would really suggest to plan beforehand. Another confusion that I find in many candidates is, do I need internship to take Plab 1? You don't. After you finish your medical graduation, you have your certificate in hand, you can book and give Plab 1. What difference does it make? The internship is that a GMC approved internship will help you to get a full GMC registration, which will allow you to apply for all known training jobs as well as directly applying for training jobs through various ways like MSRA exams. But a Plab without internship will only make you eligible for a provisional registration, and ultimately a UK foundation program will be your only go-to place. Now, you've planned for it, you've booked your Plab 1. What next? You need to start preparing. How do you prepare? The main thing is the Plab Able. This um, this forum has been going on from way before, and it's been updated and updated. I think this is the best one. Nowadays, there's multiple options for online question banks, like 1,700 questions. Even some academies have started their own question banks for Plab 1, but I think Plabable is still the best one for me. So I would suggest you to go for that. What Plabable is it's basically a question bank of more than 3,000 questions covering all the medical and surgical topics that you are assessed on in Plab 1. It also comes with explanations um, and everything. So I would suggest go for the question banks first. It's always handy to have a reference book on hand when you need further explanation, when you can't understand certain topics. I used Oxford Handbook of Clinical Medicine, which was really helpful. The next thing is mocks, as many as you can do. Because this exam, Plab 1, it's not a very, very difficult exam, but the time management skill needs to be on point, uh, because you have to attend 180 questions in 180 minutes. And some of the questions are quite tricky, especially the ones with epidemiology, where you have to do some calculations and stuff. So you need to be able to manage your time very well. How do you practice that? You give mocks. So I would suggest start giving them as early as you can. Make good of social media for once. I would say, WhatsApp groups, Instagram, Facebook have a lot of forums where you'll find people who are on the same journey as you, and a lot of tips and advices are available there, and you can do group discussions and stuff like that, cover topics in a whole day. So this is very helpful as well, so I would also suggest to keep an eye for this. When does having a friend does not help? Same with this exam. Having a study partner or a group of people who are aiming for the same goal makes the whole journey easier and fun, because it can get taxing. Okay, so I would suggest have a partner. Don't try to do it all alone. Two is always better than one. Okay, and get some sleep. Eat well. Learn to pause and detach as well. Don't burn yourself out. Okay, start early and give yourself breaks. Okay, because you have to be on point and at your best self, and you cannot do that when you're burned out. Okay, so rest well as well. You- Congratulations, now you've passed your Plab 1. What's next? This is the most exciting part, from what I can recall from my own experience. This was maybe the happiest I was in this whole journey, because I was finally coming to the UK. For someone who had never gotten out of the country, and to just the prospect of coming to the UK to give an exam, and having a possibility of working in the UK as a doctor, I think it's very special. Applying for the visa is taxing. It's difficult. There's a high rejection rate for Plab 2 visas in the Nepal, so you're always a bit scared when you're doing that as well. But I would suggest do it. You're a doctor, you're smart, and you can do it. Yeah, there are some myths associated with this visa application that I would like to briefly touch upon. Many of my candidates that I used to teach in Plab, the academy that I used to teach on, they used to be worried like they need to have a job or employment back home to show that they will be coming back after the exam. And you need to have a lot of money in your bank account, otherwise, your visa will be rejected. And you can't apply yourself, you need somebody else to apply on your behalf. I think these are all myths. I can give you my example. For instance, I applied for the visa myself. I didn't have billions in my bank account. And the moment when I applied for the Plab visa, I did not have a job. I still got my visa. How do you get that? Is you just be honest, and there's a statement of purpose of why you're attending, and I would suggest try to make that as extensive and as honest as possible, and you will get your visa. Yep. So do not believe everything you hear, and just be honest and give your best shot. Yep. Now, what is Plab 2 exam itself? I think the trickiest part, like I've mentioned here, is actually just understanding how the healthcare system in the UK works. And it's very difficult, though, if you've not worked in a UK healthcare setting. That's where the clinical attachment and everything plays a very important role, I feel. I did my clinical attachment before I gave my Plab 2 exam, so I think that helped me a lot in the exam itself. Because the things they expect from an IMG is not much, actually. I think they expect things from a junior doctor. Uh, that's very realistic, I would say. But it's just that we sometimes focus more on thinking like we need to know all the managements and all the diagnosis. A junior doctor can't do that, basically. But what should a junior doctor be able to do at minimum? Is at least be able to talk to a patient, know why they're at the hospital, know their concerns, be able to counsel them regarding what are we thinking, and how are we treating them. So these are just basic stuff, and that's what Plab 2 exam is about. They will give you so many different scenarios. You will jump from gynecology to surgery to medicine to psychiatry, an angry patient, a Breaking Bad news station. So it really tests your ability, and all of this in 8 minutes per station. So it really tests all your ability as a human being, as a doctor, and it's not just about the medical side of things. So getting familiarized and familiarizing yourself with the exam itself is what I would put on top of my priority list, is understanding what PLAB 2 is and what is expected of you. The UKMLA content map will help you with that. So I would really suggest Google it and go through the PDF. Now, how to prepare for this unique examination? It's an OSCE based assessment, but it's different from every other OSCE I've been in my life. So I would suggest prepare yourself accordingly. What are you being judged on? There's basically three grading criterias. I put on top interpersonal skills because I feel this is. I can hear someone talking. If you could please mute your mic. All right. So coming back to this, there's three grading criteria basically. The top of the list for me would be interpersonal skills because I think that affects the next two grading criteria directly. The second one is data gathering skills. What do you mean by data gathering? There's two ways that you gather data in PLAB 2. One is by talking to the patient. Yeah, that's one way of gathering data. Why are they here? What's their presenting complaint? What are their concerns? And stuff like that. The next one is the management. No, the next way of gathering data is examination. So there are some combined stations in PLAB 2 where you have to take a brief focused history followed by a focused examination. So examination, doing an abdominal examination, doing different special tests during those examination, I think you gather data as well. Then comes the most difficult part of the assessment is management skills. Let's say you took 2 minute history, you examine the patient in the next 2 minutes. Now you have 4 minutes to explain to the patient what data you've gathered so far and what do you think is going on, what are your differentials, and how do you reach to a diagnosis from those differentials through various investigations. How do you explain those investigations and diagnosis in a very simple term? So these are all skills that you have to develop. Okay, and because it's all in a foreign language for you, English is not your first language when you're an IMG, so you will have to develop that skill by coming to the UK, start talking with people in this language and practicing. Okay, this is where the role of an academy comes in. It is not mandatory. Yeah, this is something that I found out after I started teaching. I didn't know this when I was a student myself, preparing for Plateau. I thought an academy is mandatory. You can't give this exam without an academy. But later on, I found out while teaching that many students don't even join an academy. Okay, so it's not mandatory, but I would still suggest join an academy because it will help you getting oriented to this PLAB 2 exam, which is a very unique exam, and you need time to get oriented to this, as well as you meet a lot of fellow colleagues and friends that you can, at least enjoy this journey together. It is a struggle, but having a friend always helps. Yeah. So I would always suggest join an academy, spend time in the academy, practice with people. And I always used to say to my students, less reading and more talking for PLAB 2 year. The analogy that I used to give them was you cannot learn to swim by reading about different swimming techniques. Yeah. You have to jump in the water. And PLAB 2 is very similar, I think. You can't study and finish all the subjects and topics and then expect yourself to go and talk to a real human being. The knowledge really doesn't help with that. You need to develop skills, the interpersonal skills, basic stuff like how to be a good listener, empathy. Very easy to say I'm empathetic, but very difficult to practice. How many people do we meet on a daily basis who are empathetic? Very few. So all of this needs practice, and you need a friend. You need a group of people who meet daily and discuss the topics together. And let's say we're discussing a topic of chest pain. You can study all about chest pain and have differentials and know the investigation, the ACS protocol. But if you don't know how to explain that to a patient in a very, how do I say it, in a very simple manner, it won't work. So knowledge, very necessary, yes, but how to deliver that, that's actually what Plab2 is about. It will make you into a good human being, a better doctor, and you will be able to communicate with your patients a lot better. So I think it's really helpful to read, yes, but talk more. And be yourself. That's my final advice for Plab2. This is your best bet at passing this exam because I saw after encountering hundreds of Plab 2 candidates during my last year working as a tutor and Plab guide, what I found was they all are good doctors and they are all unique. But what all of them are trying to do is try to become an ideal doctor for a day, which really does not work. Okay. You have to be yourself, and you have to bet on yourself and try to help the patient. It's not always about diagnosing the case and treating it. It's also about acknowledging that the person is a human being and the medical problem is one aspect of the thing, but they have something else going on always in Plab 2, something at the house or some social issues that they are going through. And even if you're not able to diagnose the case right there and then, if you are able to help them with something they are struggling with and something that's affecting their health indirectly, you are still managing the patient. Okay, so for that, I think you have to be very natural. You have to be in the moment. You can't be in your head thinking about what is my next question or what diagnosis this could be. You're going to miss what the patient is giving you. Okay, so just be yourself. Go in with a mindset of trying to help somebody who's suffering, partially medically and partially with other issues, because in PLAB 2, they will give you multiple problems to deal with. And I would suggest just try to help them. Yeah, that's what you do in your real practice later on as well. You just try to help someone who needs help as much as you can. What do you do when they ask you something that you don't know? You be honest and tell them that I don't know. You cannot guess too much in medicine. Yeah. Yep. I'm not diving too deep into the topics and the stations and everything, what comes in Plab 1 and Plab 2, because I think that's a very extensive topic and I hope to cover that in the future sessions if possible. Yeah. So if you guys want me to dive deep into them, please mention it somewhere in the chat and we'll follow up with that. Okay. That brings me to the next part, life after Plab. Congratulations to this point already. You've gone through your medical qualification, you've gone through your English language proficiency examinations, then you've given your theory best assessment of PLAB 1, you've completed the very unique PLAB 2 exam as well. So, what happens after this? I think this is just the beginning of the journey. Actually, this is where it all starts. This is where your motivation will be tested. Your pursuit basically starts getting very difficult at this point. You have to apply for GMC registration, yeah, at this point. Start working on your CV and portfolio. My colleagues have already touched upon that, how to do that. Clinical attachment. In my case, at least, I think this was the game changer. This is where I got introduced and to, to people that have literally shaped my career so far. Mr. Ashish being one of them. This is where I learned about the NHS already, and I was able to see, okay, this is what they're looking for in a junior doctor. It, it wasn't too complex, actually. It was very simple. Audits and QIP was something totally new when I did my clinical attachment at William Harvey Hospital. This was in October 2023. I spent 3 months of my time there, and it was one of the best times ever. I got to be part of some audits and QIPs, even some research pro. I did some very interesting case reports. I even got a chance to present them at East Kent Surgical Conference that year, and that was a very good experience. I would say still helps me till this date. I was also able to be part of many training courses like basic surgical skills training course, literature review training courses, which of course built my CV and portfolio. So that's a journey on itself, life after Plab. Yeah. Then comes the time when you start applying for NHS jobs, and you're very excited at the beginning of it. You know, you work so hard to build a nice CV and have a nice statement, on the statement that where you explain your journey as a whole. But it starts becoming a struggle after a point. To give you an example, I got my GMC registration in January 2024 and I started applying for jobs through NHS Jobs. And there's a site called Track Jobs as well. Uh, I applied for, I think, almost 200 jobs, and every one of them got rejected. Yeah, not called for a single interview. I was back home in Nepal. Everyone in the family happy that passed the examination. I'm going to go soon to UK. But it all starts becoming a bit gray when you hear nothing back. You start doubting your own CV, and it's a struggle, I would say. And anyone who's been on this journey would be able to tell you how difficult it is to land an NHS job. Okay, but again, like I said, I just landed an NHS job myself. I applied for 800 jobs when I got this job, so it is a very torturous journey. But I would say don't give up, be patient, and look at it like it's a marathon and not a sprint. Okay, it is worth it. The other way, which you start to consider once your applications for non-training jobs are not being becoming fruitful, is do I directly go for the training jobs? And I see this thing trending a lot right now. A lot of my friends and colleagues and junior medical students are just preparing to get in directly into training. Yeah. How do you do that is through this thing called MSRA, a multi-specialty recruitment assessment. Yeah, it's a free exam. You can give it from anywhere in the world. Okay, and for someone sitting back home and just preparing for this exam, I've seen a lot of them come to the UK directly as a GP training or psychiatry, depending on what you want to pursue further. Yeah, but this is one way, um, and it's trending right now a lot. Other thing that you can do to boost your CV and boost your chances of landing an NHS job is demonstrate your commitment to a specialty. If you know that you want to pursue medicine or surgery, start giving the Royal College membership exams like MRCP, MRCS. These are not free examinations and by no means easy. I myself am preparing for the MRCP, so I can tell you that. Yeah. That's basically life after Plab, but a very important part of life is also money. Yep. And for someone who's coming from a country, I don't know to call it a developing country, non-developed country like Nepal, India, Pakistan, Bangladesh, uh, it's very hard for most of us at least. Okay. Uh, from my example, I've just given an estimate of my expenses of how much money you need to be saving, and you need to plan for it. I would suggest the IELTS itself cost somewhere around 200 to 250 pounds. In my time, it was 200. It has gone up. OET is a slightly bit more expensive, but because it's a medical assessment, almost many people go for OET nowadays because there's many high chance that you'll clear it in a single attempt. IELTS, on the other hand, is not as easy. Okay. Plab 1 is the price is not very expensive, I would say. It's somewhere less than £300 as of April 1, 2025, and Plab 2 is an expensive exam. It's almost £1,000 now. In my time, it was 900. So that almost translates to 2 lakhs in Nepal, which is a big deal. Okay. So you need to plan and save for these examinations. So it's always handy to know what is the estimate of your expenses. You know, the next big expense will come when you're finally decided to travel to the UK, from your flight cost to your visa cost to the academies, which are always above £600. So very, very expensive. You have to come the accommodation in UK. Anyone who's come to the UK and lived here will know how high that is. Yeah. There's also a primary resource verification through Epic. It's an electronic portfolio basically, which verifies your primary medical qualification. Very similar to the ECFMG that the USMLE uses. That too will cost you some pounds, yeah, like 200 to 250. And then comes the final cost, GMC registration. A full registration with a license to practice, from what I found with the latest, is £177. And for someone who's passed their PLAB, got their GMC registration, has not got a job, and a year has passed, you still need to pay it. License to practice would cost you even more. Without a license to practice, it is cheaper, but I would not suggest the IMGs to go for this one because most of the job applications will require you to have a license to practice, and you do not want to risk that. So I would say plan early, save money, and don't let money become something that comes in the way of your journey to the UK because it's already difficult. You don't want this because of lack of proper planning and savings. You don't want to miss out on this. Okay. And this is my last slide. It's basically my timeline. I've already taken you through it, but just to give you a brief idea, I hope it helps for someone who is somewhere along this line, and thinking if I'll reach the end or not. I just landed my first job in June 2025. I've only been in the NHS for 3 months, and it was a long journey for me. I started back in 2022 when I decided to give IELTS. From then, I gave PLAB 1, PLAB 2 at 2023, got passed the PLAB 2, did my clinical attachment at William Harvey Hospital, Ashford, under the guidance of respected Mr. Ashish. I was there for 3 months. Then I got my full GMC registration with the license to practice in January 2024. I was back home. I was lucky enough to land this job, a teaching fellow job at Plab Guide Academy in Manchester, where I worked for a whole year from June 2024 till May 2024. I think this was something that helped me land this job because I only started to get my interviews after I was in the UK. I don't know how that works, but that's just an observation that I found. Like when I was in Nepal and applying, I was not getting called for interviews. But once I was in Manchester, I started getting interviews. This was around the point where I had like 400 applications. So it is a long journey. Even an application takes almost an hour when you're just starting. Okay. But the more you keep applying, the better you start getting at the application itself. You see how you can get your application better, you know. It comes with a lot of frustration, a lot of patience needed. You start doubting your own CV, your motivation gets banged up pretty well, but you do get better with time. You know, your application is much better at 300 and 400 compared to your 100th application, let's say. So after I came to UK, I already had a sponsored job in Manchester. I never stopped applying. I used to apply and look for jobs every day. Okay, comes a point where even the jobs and the vacancies start to, you know, there are no vacancies anymore because I've applied for everything. Then my seniors and like Mr. Shrestha advised me to apply for all the jobs, not just the junior. Apply for everything and mention in the statement, you know, like what is it that you're actually looking for. You almost have to look a bit desperate. That's where I was. And that's how I landed this job because I was on it every day, even after my job. I used to come back home, I used to look for vacancies, even registrar jobs, I didn't leave. Okay, so you have to be on it and you have to want it so bad. Then finally, this year, June 2025, this was almost like a culmination of the whole cycle. This is what I dreamed of when I initially started my journey, was I wanted to get into NHS, and I'd already seen a teaser of it during my attachment of how good it might feel to be in a paid job, you know, with responsibilities. Because, like my colleague Dr. Shimwas already mentioned, in clinical attachment, you have no less responsibilities. You're by definition not supposed to be involved in the clinical aspect of things. So you're just there watching stuff and you just want to be part of the team. Actually, you start to wanting to help, you know. So this is when I realized my dream. It wasn't easy by any means. It was a very, very long journey. Many times I had thoughts of letting it be and going back home and starting some specialty training back home because time doesn't wait, isn't it? But I didn't give up. I think that was key. I never stopped applying for jobs. I never stopped asking for advice and attending sessions like this. Any, you have to turn every stone possible, you know, and then you do get the reward. And from my experience, I can tell you, I love my job right now. I'm working in a very niche specialty, renal medicine, which I had no experience prior working in. And I'm finally able to see why this was such a difficult journey because it was worth it in the end. I'm very happy. I love my job. I don't like to be on day offs now. Okay, so and you do see a future as well. You know, you have to work hard, but you can also realize your dreams. Let's say, you know, you'll be independent, working in the UK and helping patients. The colleagues are really nice and very supportive. To give you an example, I have a broken finger right now. I was playing football and broke my finger, and I didn't want to be off work. Occupational health have advised me to take off and stay at home, but I wanted to work. And the colleagues here, the seniors, everyone, are so supportive that they never let me type. I don't have to do any procedures. I just exist there in the ward and help with in whichever way I can, you know. So it's very supportive. So anyone who has a dream of working in the UK and the times are very difficult, you're not getting jobs, but I would suggest don't give up. Keep applying, keep gathering information of how you can improve your CV, how you can improve your chances of landing a job, and God willing, you will get there. Yeah, so I would like to end my presentation right here. Dr. Abhishek Tamrakar will be taking over now, who will be giving you his insights and experiences for this Royal College